My name is Brittany. I am 30 years old. I live in Chipley, Florida, and I am covered from head to toe in cysts. I have them up here. These are the squishy ones. When they get inflamed, it feels like a hot ice pick being stabbed. I have one here. This one feels more like a sack full of cottage cheese. I have them from my torso and all the way down. It's covered. The one on my chin that hangs, stuff comes out of that one. But by popping them, none of them ever go away. It just eases the pain when they're inflamed. Hey guys, I need to step back for a second. I'm starting to get a really bad headache.
Okay.
I was born with neurofibromatosis type 1, and majority of every day I have pain. And they're really inflamed right now. Robbie is my boys' father. He looked past my disorder from day one, and my two boys are just my biggest supporters. But my kids get made fun of because of the way I look. It hurts them and it breaks their heart. So I try not to go to too many school functions and stuff for them. I've been told multiple times that I look like a monster. I've had adults trying to get their kids to laugh too. I try to brush it off as much as I can, but it's hard. I get very depressed. I honestly think I'm ugly. I feel I was supposed to be in a different body and not the body that I'm in. Because the body I'm in, I hate.
Good morning, how are you?
Good, how are you?
Are you Brittany?
Yes, ma'am.
Nice to meet you, I'm Sandra. Well, what brings you here? I feel like you have neurofibromatosis, I can
Yes,
tell.
ma'am. I had neurofibromatosis type 1.
So you were essentially born with this,
Yes, ma'am.
correct? Okay, so you have, I would assume you've seen a lot of dermatologists and other doctors too?
All the time, and they just don't help.
Okay, well, let me take a look at some of these areas.
Okay.
I don't want to promise you anything before I take a look, okay? Brittany is wonderful. And it's really shocking to me that she has thousands of bumps and she has not had a single one removed. So even in one person, things can get complicated. There are different kinds of growths that can occur. So I really need to assess what she has going on and manage her expectations. Okay, I'll start from the top here. So this one, I feel a little something there at the base. My concern is sometimes when you remove a neurofibroma and you just shave it off flat, there's still some underneath, so it will sometimes just push out again. Let me take a look at that one on your chin. Yeah, that one looks pretty straightforward though too. So I feel like if I get these ones that stick out, like here, and these that are really sticking out and around your nose.
That would make a world of difference, especially around my nose.
Yeah. Okay. So now we have, you can put that back on.
We have the big mama.
Oh, the big mama. Is that what you call it? He's cute though. It's like I can almost fit my two hands together, you know, they're touching.
Oh, yeah.
So that means that I can really kind of take this off and just stitch it. I think that would be really nice. You just have a little line scar there. Brittany has many visible neurofibromas, and she knows as well as I that we can't make this go away, but I want her to feel more confident in this does not dictate her life. She can do something to sort of have some control over it. So I think that the best course of action here is to really assess the ones that are the most noticeable, the most symptomatic for her, and try to remove those. Okay, so I'm gonna numb up these bigger areas and then probably around her mouth too. Every neurofibroma is rarely unique, and you can't predict how it's gonna act. One will be like an iceberg where you just see the very tip of it, and there's a much bigger area of tissue underneath. You also don't want to remove a lot of normal tissue because you can be left with the indentation, and that can look just as bad. And you really need to be careful and conservative to try to figure out where this is and leave the proper amount of skin to try to keep this looking as normal as you can. Okay, so this one is like this top part, and then like it's a deeper part under there. So
I'm curious.
You know, there's like vessels and nerves under here we don't want to go to, but I want to just get this bump here and see. These neurofibromas are really interesting because they go pretty deep under the skin. But I was successful in removing the ones around her forehead and on her temples. So now I'm gonna move to her mouth and her chin and see whether I can remove this one that is really pretty noticeable. This cute little nubbin here. See how they herniate out? They're like under there too. So far, things are going pretty smooth. I am now about to tackle her shoulder. That's where Big Mama resides. And then I'm gonna try to treat some of the ones around her nose and on her mouth. Alrighty, here. Make sure nothing hurts. Same thing.
I feel that.
Good. This one like pulls together really well again too. They're nice and well behaved because they're all just right under there and they kind of pop out. Let's do this. There's your friend, though.
Oh, wow.
Iceberg. It's like a little Portuguese man of war.
I like that. My shoulder hasn't been flat since I was like
Really? You've had this
10.
forever? I got rid of Brittany's biggest bump, and so now I'm gonna stitch her up and move back to her face. I really wanna smooth this area up around her nose and her mouth. These are actually very complicated because there could be a lot of growth underneath the skin and they can herniate outwards. So that is always a risk, but I need to give it a try. I'm just gonna put one little bit right here, so close your eyes. She's got a little suction to help with the smell too. I'm using my electrocautery tool in this case to remove these smaller bumps around Brittany's nose and her mouth. I can kind of sculpt the areas and melt the skin really around to try to keep this as flat as possible and also have to deal with less bleeding. It's so loud.
I think the smell bothered me the most.
Brittany really is such a trooper. I think that multiple treatments she's certainly going to benefit from. So I really look forward to seeing her again. But I think she's gonna be really pleased with what we've done, certainly so far. Here you go, take a look at what we did here. Oh, careful. What do you think?
I feel like my whole life has been about this moment. It's finally happened.
Can I hug you?
Oh, of course you can.